The nurses here saved my daughter's life. My daughter had GBS. She had gone to an emergency room in Lindenhurst, Bayshore, 3 times, and they told me that she was dehydrated and she was a drug seeker, okay? My daughter's a long-distance runner. She's not a drug seeker. When we got here, the triage nurse saw me carry her into the emergency room and took her right in. She was, by the time I moved my truck, she was already in a bed. They had already drawn blood and gotten a doctor to her. By the time 48 hours went by, we had a diagnosis. The nurses didn't like that she was in a room all the way down the hall. They changed to a room right next to the office, the nurses' station, so that they looked in every 5 minutes because she was having trouble breathing. They had everything ready in case she had to be intubated. They saved her life.
Yeah, my name is Don Lippincott, and I've been a resident of this community my entire life. And a little story to tell you is about my grandmother, who hadn't been in a hospital for 55 years. And at her time of her visit here in September, it was because we had to get her out of Florida because of a hurricane. She was 101. And during her lunch on the 9th of September, she choked on a pork chop. Yeah, she's got a very good appetite at 101. And didn't want to go to the hospital. Couldn't breathe, but she didn't want to go to the hospital. So the only way to get her here was in an ambulance. And she got here, and the staff took her in, and my grandmother was absolutely fear-struck. Again, like I said, she hadn't been in a hospital my entire life. So the upshot of this is, by the time she left here 5 hours later, she had gotten all the care she needed. She had an endoscopy, and she was hungry. She was really bummed when we got her home before dinner, and she couldn't have supper that night. But in any event, she thought that the care here was unbelievable, and she doesn't fear a hospital any longer. And she's 102 now because her birthday was a couple of weeks ago, and she's still very hungry.
2 people that I really appreciate what they've done for us. One is Rich. Rich, I don't remember your last name. He's a social worker here, and I heard you told me you got a promotion, and congratulations. And he worked tirelessly with Dr. Shupek. Anybody that knows him, he's retired now, and Dr. Schiller, to get my husband the Cadillac of beds. And they kept telling me, you will not get the bed. Well, Rich got the bed. Many letters back and forth. He had to get in touch with the doctors and that, and we were able to get that bed. So that was a wonderful thing, made our lives much easier because it percusses him and it turns him, all those things you don't have to do anymore. So that's a great thing. The other person is somebody who, there was paperwork that I needed for the nursing service, and it was left on the ambulance. I called the hospital, and I spoke to one of the nurses, not that I'm going to say her name, Lisa, and it was a really bad night. It was raining and everything. Lisa got off of work at 10 o'clock, drove to my house, and delivered us the paper. But the thing is that Lisa lives here in Port Jeff, and I live in East Yaphank, which is on the other side of the island. So, staff like that, it's just very valuable to have people like that you can really, really depend on.
How they take care of my wife and be able to send her back home. She's bilateral amputee, diabetic, cardiac, you name it, she's got everything. With that, I was so impressed with the nursing staff here and how this hospital ran. I'm the paramedic program director for St. John's University. I'm a retired paramedic from the fire department. I reached out to Adam Wass and to Phil Messina because I wanted to get my paramedic students in here. And they were able to help me do that. I was also a patient here just recently. It happened to be on my birthday. And I got my meal and I got an extra surprise. Dietary came up and sang to me. So, this hospital we've been coming to, my wife has been coming to for ages. We literally live on the south side of the shore and we travel here. It's not like we live within 5 or 10 minutes. And we make sure that I get my wife here. But the staff here, they're kick-ass.
A few years ago, I had an employee of mine admitted to Mather. I went to visit him and recognized many of the staff caring for him. He was treated with compassion, professionalism, and wonderful care, which led to a speedy recovery. Not too long after that, my sister was admitted to the hospital suffering from an ailment. She had a 2-day stay. After my sister returned home, she called me and thanked me for making a call to the hospital and said she received the royal treatment. I informed her that I was unaware that she was even in the hospital and that they had no idea she was my sister. This showed me that everyone gets the royal treatment here at Mather.
Hello, Review Board. My name is Christine Cady, and as you know, I'm a registered nurse here down in the emergency department. And on June 26th of 2016 was the worst day of my life. I left my shift here on a 12 to 12, driving home, found myself 3 blocks from my house and had a seizure. Unbeknownst to me, I had a brain tumor. I was taken from the accident scene where I actually thought I was having a hemorrhagic stroke and brought to Mather. I was in chest pain 1, and Dr. Kenneth Hirsch came up to my bed and said in a cracker voice, "Christine, I don't know how to tell you this. You have a brain tumor, and it's big, and it's bad." I was taken up to the ICU. I was cared for by the most wonderful nurses who took the time to not only sit there and talk to me about my diagnosis, which I knew about, but to pray with me. Every single nurse that I work with down the ER, there was a line of nurses outside my room. I don't have any family on Long Island, but I have a family here. Mather nurses are the top nurses in the world.